According to the Center for Disease Control and Prevention, in 2016, more than 46 people a day died as a result of prescription opioid overdoses. From 2015 to 2016, 63 people died from opioid overdoses here in Central Virginia alone. I sat down and spoke to a man that was once hooked on opiate-based painkillers. The man asked that we conceal his identity because of the stigma and judgment surrounding opioid addicts.
I would love to go out and counsel people and tell them how much this has saved my life. I have a kid now. I have a wife. I own my home. We have multiple vehicles. We have savings accounts. We are involved in the stock market, but nobody would think that I go to the methadone clinic or that I've had a problem, because there's that bad stigma on it. Everybody looks down on you. Everybody says, oh, well, yeah, that guy, he does drugs. Like, that's not what it is. The way opiates have literally caught everyone.
To protect his identity, we will call him John. John shared with us how he got hooked on prescription painkillers.
I was a three-sport athlete, loving life, loving everything. I was playing running back, ran up through the middle, through the gap, and I got hit in the knee. I tore my ACL. I went to the emergency room, and I got put on some narcotics. Then I ended up having surgery and everything, and through the entire physical therapy process, I was being prescribed narcotics through the doctor. I continued taking them, and then the doctor stopped giving them to me. Well, at that point, I could really realize I was addicted. So it got to a point where the sniffing of the pills wasn't working out anymore, that I needed a better fix. So it was getting to the point where I was smoking them, to where I was hanging out with people that were, slamming them up and stuff, and that wasn't me. That wasn't about that's not who I was.
According to a 2016 report from the U.S. Surgeon General's office, only 10% of people in the United States with drug abuse disorders receive specialty treatments. That low rate, according to the report, was attributed to a shortage of treatment options for addicts. Luckily for John, he had access to an opioid treatment center close to his home in Harrisonburg, Virginia.
I went to my parents one day and I told them, well, my sister, my mom, and my wife looked into, treatments and etc., and they found a methadone clinic.
Aside from the treatment center in Harrisonburg, there are similar facilities in Richmond, Charlottesville, Winchester, and Roanoke. Over the summer of 2016, 30 people in the Staunton, Virginia area were treated in the local emergency room for opioid overdoses. Now this area also has access to treatment. On January 3rd, 2018, River City Comprehensive Counseling Services opened an opioid treatment center in Staunton, Virginia that is designed to serve 300 patients at capacity. With a vast network of treatment centers, the Shenandoah Valley is now covered from its most northern border city to its most southern, giving many opioid addicts in this area a treatment option that is not as easily accessible in other parts of the state or the country. I sat down and spoke to the Staunton Treatment Center's director, Matt Hahn. He said the facility aims to combine medication and comprehensive counseling to treat their patients' addictions.
They'll always have that craving and that urge to use. See, we want people to know that we provide counseling, we provide medication for people to get on with their lives.
Tiffany Fulton is a substance abuse counselor at the Staunton Treatment Center.
We believe that addiction is a disease, just like diabetes is a disease to other individuals. And so this medication is going to help them sustain a better working life. The counseling is going to help them with their coping skills and work on their past issues that they've had that led them to substance abuse issues, along with mental health. We want to just improve their overall life and get them back to as normal as possible.
John showed us what his 65 milligram dose looks like. Karen Simonson is the charge nurse at the Staunton Treatment Center.
When patients come in, I complete assessments, I manage their withdrawal, I administer medications, and I work with the physician to make sure they're prescribed the appropriate dose. I work with the counselors to make sure that their clinical, the clinical portion of their treatment is being completed.
Karen touted the success rate of opioid treatment centers compared to that of traditional drug rehabilitation facilities.
The Coleman Institute recently published a study that shows that abstinence-based treatment programs, traditional treatment programs that sometimes you'll find at the beach or at a lodge in the mountains, will yield a 3% no relapse success rate. Opioid treatment facilities wield a 59% no relapse percentage rate.
The only downside we could find to this treatment is that opioid addiction treatment at these centers can be very costly. Currently, it costs a patient $15 a day for their medication. But John says it's worth it and says it's cheaper than being hooked on drugs.
Truly, where else are you going to find that you can pay $16 a day, $112 a week, which, yes, that's a lot of money. That is, don't get me wrong. But $112 to see a counselor as much as you possibly need to, and to also get the medication that you need. You gotta think, man, you're going out, you're buying dope. It's $60 a bag, $20 here, and you're not just buying one, you're buying multiple, man. So you got something to get you through the whole week, and you also have a counselor there.
John says that some patients don't follow the program and therefore are unsuccessful, but those that do follow the program and want to improve their lives can.
Until you realize that you need counseling, that you need help, and that the counseling is more important than the drugs, you're never going to be cured.
Simonson says her work is very rewarding.
This line of work is the most rewarding because we've noticed that in our community hasn't been immune to experiencing the opioid crisis. So we've been losing people in our community, we've been losing our friends, we've been losing our family members. So me getting an opportunity to treat them as a nurse in a medication-assisted treatment facility and see how their lives change and see how we are changing the course of their future is incredibly rewarding.
If you or anyone you know in the Shenandoah Valley suffers from opioid addiction, there is a link to the Staunton Treatment Center in the comments section of our Facebook page under this story. In Staunton, Theo Whitelow for Breaking Through.